It's that subtle kind of misinformation where you don't always say things that are false, but you just say things that are true but misleading. So a lot of the things like Ivali and gateway effects and the presentation of youth data, you have never ever heard anyone from CDC or FDA say, well, that young person who's vaping, well, in a world without vapes, that person would have been a smoker, would have been an adolescent smoker. They have never embraced that thought. And Brian King, does one if you even ask him to think about that. So they are rejecting the underlying public health rationale here for harm reduction as it applies to young people, which is that they're diverted away from smoking. So the charge sheet for both FDA and CDC is very long. The question is whether, when you raise those criticisms of CDC, as voiced by the nominees or FDA for that matter, is that what they're talking about, or are they off on some mad thing about vaccines? Because and no one's going to convince me.